Hey everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well, and welcome back to a very interesting case. I'm going to pause right here. So that is where the eardrum should be, and roughly is, but it's covered by a layer of, as you can see, bloody dead skin. That is sort of a weird sort of balloon style configuration, but there's nothing really to worry about. It's dead skin again. So what's happened here? This patient, about 10 weeks ago, you can kind of see the eardrum through that little hole. About 10 weeks ago, the patient had an earwax blockage and decided to try and solve that by getting a sort of ear syringe off Amazon. So it's like a home ear cleaning kit. And the wife filled it with warm water, which is fine, and then plunged it into the patient's ear. Immediate pain, blood pouring out of the ear, immediate hearing loss. And I think we can safely assume that he perforated his eardrum. So a day after that, he went to see his general practitioner doctor, who very sensibly told him not to worry, it's fine, eardrum perforations happen, it's not fatal, doesn't require immediate surgery, and most perfs heal within about 2 months, so which is correct. But the doctor said he couldn't see a thing because the ear was just full of blood and mess and dead skin. Okay, and when you see sort of, you know, all this kind of weird dead skin in kind of these unusual sculpted formations, we do sometimes see that if a syringing has been done, but it's been done incompletely, so that the procedure has been aborted before all the stuff came out. So the doctor said, look, go and get your ear cleaned, and then, you know, wait a while and the perf should close. As long as it doesn't get infected or, you know, traumatized, then you should be fine. So he came to see me the day after that. However, at that time, I decided not to proceed. I decided not to do the procedure and wait 10 weeks. Why? So when he came to see me, initially, the ear looked very much like it did at the start of the video, just a bit wetter and a bit bloodier. I could kind of roughly guess where the eardrum was, but the ear, by that point, the blood has started to sort of crust and, you know, dry. And there was this layer of dead skin across the drum. Now, if you have a perforated eardrum, or like recently perforated, it's generally not a good idea to mess with it. And certainly, you know, a little bit of earwax removal is probably low risk, but generally speaking, do not take things off the drum. Do not peel dead skin off the drum, do not syringe it, because what you might end up doing is destroying the healing process. Now, if it was a very tiny perf or like a tear where the edges of the perf were essentially touching, then it will close quite quickly. And I suspect that's what's happened here, because the end result is very good, like cosmetically, so to speak. You know, you wouldn't tell there was a perforation there, which kind of implies that it was a tear, and the edges of the perf, although, you know, the skin or the membrane was broken, the edges of the perf were sufficiently close enough to, I guess, heal by primary intention, so to speak. So generally when the body is damaged, if you have a wound, it either heals by primary intention, where the edges of the wound are near enough touching, and that will have good cosmetic and functional results. And then if you have like an ulcer, like a big area of the body, like you fall off your motorcycle, for example, and you have a big wound and it can't, you know, the edges of the wound don't touch, then that's healing by secondary intention. And the wound has to fill with granulation tissue, and then the skin has to grow over, and then you're left with scar tissue and poor cosmetic results. And the scar tissue isn't stretchy either, like skin. Not that an eardrum would heal with, you know, secondary intention, but you get what I'm saying. It was probably a small perf. So if I was to go in on day 3 and start stripping all that dead skin away off the drum, there's a good chance that I could have disturbed something and reopened the perf when it was well on its way to healing. So waiting 10 weeks, probably a bit of an overkill, but I thought, you know what, most perfs heal within 8 weeks. If I give them a 2-week buffer, then I'm on the safe side and I'm not going to destroy anything. So eardrum looks pretty good. And again, you can't really tell where it was perforated, which is a good sign. So sometimes you can tell if the drum has a sort of area of thinning, so there's a darker area, or there's like an area of like kind of chalky whiteness, which is scar tissue or tympanosclerosis. So it's calcification, basically. A little bit of dead skin here, but overall I feel this is quite a good scenario really here. He's he's gotten away with it, basically. Didn't get infected, not re-traumatized, and he's generally done what the GP and me asked him to do, which is keep water out of his ears the entire time and be very strict with it. Don't let any water in your ear whatsoever. Any pain, obviously, present straight to the doctor. But this is a very, very good outcome. One thing we're going to do at the very last moment is get the patient to do a Valsalva maneuver, which is where he'll pinch his nose, try and blow through his nose as it's closed, and then the air will have nowhere to go but shoot up his eustachian tube to fill the middle ear cavity, inflate the middle ear cavity, and that should make his eardrum, if it's not perforated, deflect outwards. So, and if there was a perf that we couldn't see, normally it will either make a sound or you'll see like fluid arising out of that perf. So it's usually very, very obvious. Just a last little bit of dead skin here with the fine end. And now we'll ask him to do a Valsalva. Again, we're looking for the eardrum to sort of inflate towards us like a balloon kind of thing. There we go, perfect. So you can't really tell that there was anything wrong at all. So there we go. I hope that explains a little bit about how eardrum perforations work. Again, it's not a disaster. It's not automatic maryngoplasty or tympanoplasty, which are sort of reconstruction type ear operations. Very, very good actually, very, very sophisticated and smart ear operations that have usually good outcomes, grafting a perf. But no need for that, just a little bit of microsuction and TLC and of course patience. So there we go. I hope you found that video interesting. If you have any questions, leave them down in the comment section below and I will try my very best to get back to you. And of course, I will see you guys on the next video.